Hi guys, Dr. Nathan Burrow back again. If you missed the last two videos, we talked about disease, we talked about doctors. Make sure to go back and look at those because we're going to be branching a little farther into those topics. So, quick refresher on those. Disease is going to be defined as an abnormal condition causing a functional or a structural issue inside of an organism, while a doctor's job is to not only identify by diagnosing that condition, it's to go in and correct it by treating it and then prevent it from happening later. Okay. So with that mindset, there's a lot of different approaches that you can have on the treatment and the prevention of said condition. And that's where we're going to branch into today's topic of allopathic versus holistic medicine. I'm going to try my best not to get in the weeds on this one because it's a little hard not to. I could go a little too far in depth. So anyway, with that said, the biggest difference when you're talking about a holistic versus an allopathic approach is literally the idea of how that condition is going to be treated, okay? It's the belief of what's needed to do it, okay? So when you're talking about a holistic mindset, which we'll go ahead and branch into that first, the belief is that that condition is curable or at least fixable if the body is strong enough to either fight it off or to totally expel the causes that were causing it to start with, okay? And the reason I say it like that is because there's different ways to approach all conditions, right? There's different causes for all sorts of things. If you have a viral or a bacterial entity, obviously there's an external source causing that, okay? You have approaches that are different than that. You also have issues that are gonna be internally based where you're having metabolic issues, right? And stuff like that, or say injuries, right? I could have an injury where I was over fatiguing myself for too long. That was self-induced, okay? But you could also have musculoskeletal issues where I had a gunshot wound, or I took a linebacker, went straight through my knee and like just took my leg out, right? Or something like that. There's different modes. That was an external source that caused it, okay? So car wreck, that's another good one. So there's different causes to these, just like there's different approaches on fixing it. And again, not one is right, not one is wrong. They're just different, okay? So when we're talking about the holistic approaches, it's going to be the body is capable of fighting off whatever that issue was from within, okay? And allopathic is going to be opposite. It's going to be, we're going to treat that organ or issue by introducing something externally, okay? So when we're talking about the holistic mindset, it's more of I'm going to focus on nutrition. I'm going to focus on strengthening both exercise. I'm going to make sure we're plenty hydrated. I'm going to get the body or the organism as strong as I possibly can and make sure everything is working at optimal levels. And in doing so, I'm giving it every single chance in order to either prevent or to fix whatever's going on, okay? So basically, the stronger you are, the more you can take, the more that you can fix, because it's just not going to be bugged as much. I feel like that's a pretty easy thought there, that the thicker your skin is, the less it's going to bug you. You know what I mean? Like, if you have a piece of paper, right, it's not going to be nearly as strong as a sheet of metal, right? So if you're sitting there like throwing stuff at it, you can break through that paper real easy, but it takes a lot in order to get through that metal. The defenses are stronger, everything like that. So the holistic mindset is more get the body as strong as it can, because you have the ability to fix whatever's going on by just giving the body not only the tools, but the strength from within in order to do it, okay? While the allopathic mindset is going to be opposite. It may be that the body's as strong as it can get. It may not. It doesn't matter. The thought is that I need to introduce something externally to fix that issue. I need to reinforce the body basically, because it's just not able to fight it off by itself. We need to give aid to the body, okay? So it's almost more of a let's assist it somehow by introducing a medication, a surgery, or something like that externally in order to give it the tools. It doesn't have the tools within, or it's not going to get to a state where it can. So we need to go ahead and introduce that stuff to fight it off. That's the biggest differences in the two, okay? Now there's a lot of different approaches to a lot of different things like we've talked about before. So like I said earlier, you have external sources that cause issues. You have internal sources that cause issues. There's holistic approaches to both of those, okay? So let's talk about viruses and bacteria as one of those, right? So when we're talking about stuff like that, is there a cut and dry better way of going about it? It really depends on what's going on. Like if you have a bacterial infection, can the body fight it off? It's possible, but if it goes over rampant, it's going to overpower the body, and that's when you need to go towards an allopathic realm. Make sure you're introducing an antibiotic to it, right? Viruses, same boat. You might not necessarily have a specific thing that's going to fix it. You can prevent it sometimes with certain means, but for the most part, with the virus, it's one of those that if the body's strong enough, then a lot of times that virus can't even penetrate the wall to get through in order to get you sick to start with. But once it does, sometimes you've passed the holistic realm where it's already penetrated the walls. You can't do anything. You need to intervene with an allopathic type approach in order to give the body more tools to fight it off, because obviously it didn't have the strength to do it, okay? So it's just different ways of thinking about it as far as that goes. Now, we could also go into the more, I'll say, in the metabolic type mindset, where you have different conditions, whether it be causing hormone issues, whether it be causing blood sugar issues, whatever it happens to be, where I could approach it with okay, there was something that I'm not doing in my life, or maybe something I am doing that's causing this, and I need to just stop or correct it. I need to make myself stronger, whether that's let's go ahead and get the body stronger as a whole with exercise, or whether it's like let's go ahead and get some nutrition backing or something like that in there. Anyway, there's ways that I can strengthen the body in order to maybe correct this metabolic issue from within. While there's other approaches that's like, I can't do that. I need to correct it externally because I don't have the tools within in order to do that. And that's when you introduce things like the metformin and stuff like that in order to just correct the issues that are going on, okay? So that's the biggest difference, is one is trying to treat from within, the other is trying to treat from externally, right? So let's branch into my realm as far as a chiropractor goes, just because that's a really good way of thinking about it. So my realm is going to be in biomechanics, right? I'm making sure everything in the body is moving correctly, as we talked about before, okay? So with that said, the way I approach conditions is I'm trying to make sure that your body is functioning at an optimal level, right? If everything is moving correctly, joint and muscle, and we get it to where it's actually functioning correctly, then the condition should go away, because we have made it to where the body has been optimized and we have got it back to where we have full range of motion, everything's good, the muscle's nice and strong again. Sometimes that does take time. I can't just snap and have things heal. I'm basically trying to smooth out concrete, and once I get it smoothed out, I just need to maintain it being smooth while it dries, right? So I'm putting you in a spot where you're opened up, your SI is moving, your muscles are stretched out, all that sort of stuff, everything good. And then I just need to keep it there while it continues to get stronger and stronger. And as that body gets stronger in that state, it's able to go take those stresses that were causing those issues long term, right? Because it's just not as big of a deal then. The body's strong in those spots. We just need to get it there. While the allopathic approach to what I just said is more of okay, there's a bunch of issues there. I need to intervene by doing a surgery or something like that in order to get rid of said issues, okay? So there hits a spot where maybe whatever I'm doing isn't helping, right? Well, maybe we've got the function back in there and it's still intervening. Well, maybe it hit a spot where it's more structural, which again, that's a little bonus topic, but like I said earlier, abnormal condition causing functional or structural issues. I'm dealing as more of a holistic doc that specializes in function, right? There's people that specialize more in that structure. So maybe we get the function all back, right? But there's still a structural issue that's causing those problems. We need to go correct said structural issue. That's when we're gonna go probably talk to an osteopath or a orthopedist who can maybe get in there and go ahead and approach it by cutting in and go ahead and correct it that way. Take out the bone spur, take out maybe the disc really is causing it. We need to go ahead and correct it, whatever it happens to be, and we're gonna intervene externally in those cases, okay? So there's different approaches to everything, right? And there's different ways of looking at it. Sometimes it's better to go ahead and get the body nice and strong and see if that corrects it. Sometimes we need to intervene externally in order to correct said issues. Is there a clean cut right, wrong? No, there's a lot of times where both are going on and we need to go ahead and just rule one out, right? So maybe you have an issue that's being caused externally, but you could get the body stronger. So which one are you going to go towards first? You know what I mean? So Anyway, that's also why it's getting gray, so we should probably go ahead and stop it here. So anyway, I hope y'all got to learn something. Big thing again, just make informed decisions. Next time we're going to go ahead and jump into more of types of injuries. So we're going to be talking about acute, chronic, and permanent injuries. So just a fun little tidbit there. Look forward to seeing y'all next time, and talk to you soon. Have a blessed day. Bye.